We see a lot of people at the hospital who come in with very high suicide risk. Oftentimes it's following a suicide attempt. And so a number of years ago we decided to design a specific group to help these people. So we designed, it's really a cognitive behavioral suicide prevention group. And this is based on research evidence that supports cognitive therapy and safety planning for suicide prevention. Oftentimes we'll start by talking about reasons for living, and patients will start to help each other to consider, in addition to reasons that they were considering or even attempting suicide, what are some of their reasons for living? What are some of the things that are really valuable in their life? What are some of the unwanted consequences of death?
When we're doing suicide prevention groups, sometimes you have to approach the topic of suicide cautiously because sometimes it turns people off or they may not want to talk about it. But part of getting in a group and talking about it together helps to break down that stigma because we're talking about it, and it's something that's okay to talk about, and we need to learn that as a society to help people feel comfortable reaching out for help and talking about their feelings, because it's a hard thing to do, but it's necessary.
But much of the focus ends up being on safety planning, and this is something that has been found to be effective, which is we help people to develop a plan to get through suicidal crises that could occur at some point in the future. And to do this, we developed our own version of a coping card, is what we call it, and this helps to structure the group in that it's a template that has a number of areas that we work on with the patients, and we do this in a very collaborative manner. And we help them to not only identify reasons for living on this card, but also to come up with coping strategies, which are actions that the person would be able and willing to take when they're going into a mental health crisis.
As the patients go through the different categories on the card, the coping skills, the reasons for living, they get different ideas from each other that they might not have thought of before. Maybe there's a community support that they didn't think about, going to a church leader or calling their doctor, or maybe there's a specific coping skill that one patient really enjoys and another patient had forgotten about and thought, oh, well, that would be a really good one too. I hadn't thought about that.
And we will work with patients on ways that they can get through suicidal crises by doing some actions such as distraction. And there are going to be hundreds of things a person could think of to use simple distraction. We also encourage them to have some social distraction as well as some social support. In fact, that's one of the most important things a person can do, is have some identified people that they can contact, that they can talk to in person or on the phone if they are struggling with suicidal ideas. We've seen quite a few successes, and of course a lot of the successes that we hopefully have, we just aren't able to see because the person's away from the hospital. But we have had, for example, a patient who came back here after about 8 months out of the hospital. They were readmitted to the hospital, and we had them back in the group, and they actually told us how they had used their crisis card, their coping card, and had put it in a sock drawer so they would see it every day. And she ended up going into a suicidal crisis and decided to start really reviewing the card, and she listened to what was on her coping card and went with it. And although she ended up in the hospital, she coped fairly well and remained alive, most importantly.